Well, finally, some good news about HRT in the press. This is a recent publication. Major Women's Health Study supports hormone replacement therapy in early menopause. All of this stems from a recent publication that was after the 20-year anniversary of the WHI. That is the Women's Health Initiative, a continuing, ongoing, large database that has done a lot of research. And they specifically put out a publication in 2002 that shadowed the risks of HRT. And to this day has biased medical providers into thinking hormone therapy is bad. If you polled 10 out of 10 gynecologists, I think 9 of them would tell you not to take HRT. 10 out of 10 family practice doctors, 10 of them would tell you not to take hormones. So this is a win for us, and let's take a deeper look at what the study shows. Key takeaways are hormone therapy can safely ease middle-aged women's symptoms during early menopause. Yes, you can use them for symptoms. Women younger than 60 can use therapy without significantly increasing the risk of breast cancer. However, we can't say that it will decrease your risk of strokes, dementia, and other chronic diseases. So let's remember the reason the study was done in the first place is because they wanted the FDA to say, everyone take this drug to prevent heart disease. And in the course of doing that study, after 5 years, they saw an increased risk of breast cancer and increased risk of blood clots. That was later attributed to a synthetic progestin. In this article, Dr. Joanne Manson also goes on to say that what's more commonly used today is transdermal estrogen in a gel or a patch, which is what we use with our patients, and micronized progesterone. So if your doctor has told you that it's risky and you shouldn't use it, and you're wondering about this, maybe you should find a provider that is more versed with the common studies and the more updated studies about hormone therapy, because according to this article, more women potentially should be using it in early menopause.